When I'm talking to a patient and going through their blood work, I'm very thorough. I'm making sure that I'm touching on each of the biomarkers, explaining what they do, and explaining what makes a good result and a bad result. And it's really important to me that when someone gets off the phone with me or leaves our clinic, that they feel empowered and educated, and that they are able to make the right decision when it comes to their care, that they don't feel confused, that they don't feel forced to make a decision. And if they're on the fence about a treatment, that's totally okay with me. I'd say this is a decision on your own. I'm here to educate and support you. And sometimes I'll tell them, when it comes to the time, you'll know it. And then you'll feel like you're making the right decision. And when I'm going through that blood work, I enjoy explaining it in a way where they're understanding it. I hear back from people all the time. I've never had blood work that I've had so much information on, gone so into depth with, and now I understand what you're talking about. They'll just say, okay, this is good. And they'll want to know why it's good or what it is, or if it's good enough, but could it be better, and things like that. To hear people that enjoy that experience, because sometimes I feel like I'm giving them too much information and it's either overwhelming or boring. Yeah. But when they give me positive feedback and they're like, I enjoyed this, I feel like I learned a lot, then I'm really happy about that.